Hi, in this episode we're going to talk about finasteride again, specifically side effects of finasteride, certainly that you may get soon after you start therapy. So stick around.
Welcome to the Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everyone and welcome back to the Hair Loss Show, episode 75. I see a lot of patients, Russell sees a lot of patients, and we start patients on finasteride for hair loss. But I also see a lot of patients that have come to me, and surprising, we've seen this more and more frequently. I've had patients that have gone, I've tried finasteride and it's horrible. I've had side effects. And we sort of try and dig deeper into it and say, I took one tablet and the next day I experienced a loss of libido, or I experienced breast sensitivity. And I don't doubt that that's true. I don't doubt the validity of that statement. I do think it is highly, highly unlikely that this is a direct biochemical or physical cause of the medication. Because if we look at finasteride, and certainly finasteride in the ecosphere of hair loss and the dose that we start people on, we're generally starting at a very low dose, and for most people that's a milligram. My starting dose is a milligram 3 times a week. But a milligram is a very small dose. If you look at finasteride and where it was introduced into medical therapy as a whole, it was originally designed for people who had enlarged prostates, and we were giving 5 milligrams a day, which is 35 milligrams a week. I'm arguing that we could stabilize hair loss with 3 milligrams a week. But 1 milligram, if you take a 1 milligram tablet, I think the dose is so low that it's highly, highly, highly unlikely that can result physically in the symptoms or the side effects that you normally see and hear and read about finasteride. So again, I'm not discounting that can never happen. I think it's very unlikely. But people do experience these symptoms sometimes very early on when they're taking the medication. So I think there's probably what we call the nocebo effect that probably has a larger part to play. If people are primed, they're reading a lot of information, they're watching stuff on YouTube, and they're sort of primed about the negative effects, then it becomes a self-fulfilling prophecy. So if you are getting side effects relatively early on, I think, be reassured it's unlikely to be the dose. It can be. I'm not saying definitively not, but most of the time, highly unlikely. But again, really important, speak with your prescribing physician. And so hopefully that they can guide you through this maze and get you through that point where you get to that sweet spot where you're minimizing the hair loss and not experiencing side effects at all. All right. Thanks very much for watching. Please remember to like and subscribe the channel, and we'll see you again on the next episode. Take care.